Hi everyone. I'm sure there have been occasions when you've been talking to one of your healthcare professionals and perhaps have struggled with some of the medical words or terminology that's being used. So today I would like to spend a few minutes explaining the meaning behind some of these medical terms. And we'll start in alphabetical order. So the first word then is abdomen. And this basically is the area of the body between the chest and the hips, the front part of your body, where the stoma is brought out by your surgeon. Adjuvant therapy, and this is a type of therapy that assists another therapy. So adjuvant therapy can be given either before or after your operation for the treatment of bowel cancer, for example, with chemotherapy. Anastomosis, this is the surgical join of two cut ends of bowel, and an anastomosis may be either hand sewn or joined by the use of surgical staples. Benign, and this is non-cancerous or non-malignant. Chemical irritant, dermatitis, and this is the inflammation of the peristomal skin, which is the skin around the stoma, due to direct toxic reaction from perhaps fecal or urinary leakage, or perhaps ostomy deodorants or solvents. Flush stoma, and this is where the stoma, the lining of the stoma, is at a level with the skin, either the entire way around or just partially. And the stoma may be flush, perhaps because of surgical technique difficulties. So in some cases, the surgeons had difficulty trying to mobilize or pull the bowel up to the surface, or perhaps due to weight gain. Granulomas, this is a term used to describe small reddish raised areas or nodules on the edge of the stoma or on the actual skin, just beside the stoma. Commonly caused by local irritation from perhaps the stoma appliance or suture sites, and sometimes due to chronic leakage of effluent. Maceration, this is when the peristomal skin becomes excoriated and moist. And malignancy is another term for cancer. Pancaking, when stool sits around the top of the stoma appliance instead of actually falling down into your pouch. And finally, polyps. These are small growths in the bowel that vary in shape and size. And these polyps are usually benign or non-malignant, but can undergo malignant changes over a very long period of time. And polyps in the bowel are much more common after middle age. So thanks very much for joining me today. In the next video, we will focus on the definition of words used to describe your ostomy equipment.